name's Herb Garner, 43 years old. I'm originally from the Detroit, Michigan area. I've always been a big guy. In high school, I was always active though. I did marching band, I did a year in track, was always flying around and stuff like that with people that, you know, were skinnier and all that stuff, but I was always able to keep up with them. I was always an agile, big guy. My family's real big for me. My brother and sister-in-law had my niece, and now I got my niece and my nephew. And they're a major motivational thing for me in my life. A major reason why I actually did this surgery.
Herb was suffering from gastroesophageal reflux disease. He had prediabetes, high blood pressure, and some joint pain. And we talked about the different surgical options to help him with some of the comorbidities related to his disease of obesity. And we settled on the Roux-en-Y divided gastric bypass. The options that we have for surgery include the gastric bypass and the laparoscopic gastric sleeve, but because of his reflux disease and the pre-diabetes, we thought that the gastric bypass offered him the best chance of a cure.
I decided to do the surgery because my quality of life was rapidly declining. I used to be able to walk around work, 4 or 5 miles, not a problem. Before surgery, I was down to a mile, maybe 2 at most, and I was almost always constantly in pain. That was a major decision for me because my niece and my nephew, I like to walk around with them, I like to play around with them. I was not able to do those things. You want to stop hurting, and you're tired of always hurting. And it's like an endless cycle downward around that. And so, this surgery was one of those options. Now, when I rolled into it, I wanted to do it naturally. I didn't necessarily wanted to have the surgery. I was trying to do it, diet, exercise, all that kind of stuff. And it just kept yo-yoing, going up and down, back and forth. And I could never keep off the weight, and I never really lost a whole lot of weight, maybe 20, 30 pounds at most. And then it would come back and be even more when, you stop doing it. That was kind of where it was really the final decision that, okay, it's time. I got to make a change.
So there are many options for dealing with the disease of obesity. Obviously, there's nutritional counseling, there's dietary options, meal replacement plans, there's even medication to help with the disease of obesity. We thought that Herb would benefit greatly from the surgical treatment of his obesity because of the extent of the weight loss that he had to lose to really make an impact on his overall health. We went through an entire process of discussing the risks and benefits of the various operations that we offer. And when you looked at the high amount of benefit that he had from the gastric bypass versus the small amount of risk that he thought that was the right choice for him.
The reason why I chose to do the bypass over the sleeve is sometimes the sleeve will give you acid reflux, and I already was a sufferer of that. Also, the Roux-en-Y, it gives you a greater weight loss because it works in 2 different facets, where the sleeve more or less just limits the consumption that you can do, where Roux-en-Y limits the consumption, but also it works on a nutritional level as well, because they do a little thing with the intestine as well. So it works in 2 different facets to give you a greater benefit. So after the surgery, the first 2 weeks were hard. The first 2 weeks, I was really second guessing had I made the right decision onto it. At that point, that's where I had to trust the center, trust the nurses, the nutritionists, being able to reach out, because with COVID, again, all in-person stuff was very, very, very limited and minimal. So using the MyChart app and phone call and stuff like that, that really helped out, to get me through those tough periods of time. Every week I was progressively getting better because I was trusting the process. I was walking. I was noticing I was able to walk more. At my heaviest, I was 470 pounds. Today, right now, sitting in front of you, I am 185 pounds. So I have lost 200 and 85 pounds. And that's a little over 2.5 years ago that I've made this transformation.
Here at the Weight Management Institute, we offer a variety of options for people to deal with the disease of obesity. We have nutrition solutions, which is part of our medical weight management process, which involves food-based dietary options, behavioral counseling, and medical management. And then we also have surgical options. We have 5 surgeons that practice bariatric surgery within our office. We offer both the gastric bypass and the laparoscopic gastric sleeve. What we're going to do when you come into our office is we'll sit you down, we'll talk about all the available options, and we'll talk about what the risks and benefits are of the procedure and how your life may be impacted by bariatric surgery.
So the care of this program is great. I've been truly blessed with them. It starts out like I joined, again, when I decided to do this, I knew I needed help with weight. And so I joined the program and stuff like that because of the lifetime support you get on the medical, on therapy, on nutrition, all that you have a lifetime support with. And so I joined because of that, not because I wanted to necessarily have the surgery. And they held my hand through the entire process of making sure that everything was met so that my insurance would cover my surgery. Onto it. It's not something that I had to attack alone on this monumental hill of what do I do? How do I get this done? What forms do I need to fill out? What processes? What kind of tracking? They do it all for you.
If you're suffering from the disease of obesity, we highly encourage you to make a consultation request to come see us at the Weight Management Institute. We'll have an honest conversation about the risks and benefits of surgical treatment for obesity. We'll tell you what your options are, and we'll get you on the path to a better life.